Welcome to Cumbria Children and Young People's Resilience, Emotional Wellbeing and Mental Health Plan. What is a local transformation plan? It's a plan saying how we're going to improve our emotional health and wellbeing services for children and young people in Cumbria. We first wrote it in October 2015. We have updated it twice since then. This is the third update of the Cumbria Transformation Plan. Our goal is to improve the emotional well-being and mental health of children and young people in Cumbria and make it easier for them and their families to get help and support when they need it. We have worked with many people and organisations to update this year's plan. We know that some things need to change for the better, and we have listened to children, young people and their families as they have told us how it's sometimes hard to get help with mental health problems.
Hello, my name's Julia Westerway. I work in Morecambe Bay Clinical Commissioning Group, and I'm responsible for making sure that we commission the right health services for children and young people when they have emotional and mental health needs. So one of the things that's really important for children and young people is that when they are in crisis and need some urgent help, they can get the help that they need. That means having 7-day services that are available for them so that they're not having to wait when they need that urgent help. In particular, we need to make sure that there are safe places for young people to go to when they need urgent help. And that might be going to a local hospital, A&E department, but it might be finding other places where we could provide that safe support for them. And we also want to make sure that for the very small number of children and young people who need specialist services in a mental health hospital, that they can get into the hospital quickly and that they're supported through their journey into hospital and then back when they come back home again afterwards.
Hello, my name is Greg Everett. I'm a Commissioning Manager at North Cumbria Clinical Commissioning Group, and I'm responsible for commissioning mental health services for children and young people in North Cumbria. One of our priorities is access, and this is about improving access to help for children and young people with emotional well-being or mental health needs. This is both having access to the right level of support and at the time that they need it. One way we're doing this is to work with schools so that they have all the information they need to be able to support children and young people to get to the right level of service, as I say, at the time they need it. But we're also doing other things like improving the digital means of enabling children and young people to get access to services, and also the full range of skills that exists in the workforce, so that there's a variety of skills that can respond as required.
Hello, my name is Anne Shepherd and I work for Cumbria County Council as Strategic Manager for Children and Young People's Emotional Wellbeing and Mental Health. We know that building resilience and being resilient has a great protective influence on children and young people's emotional well-being and mental health. And we also know that resilience skills can be learnt. We're working very hard to ensure that families and parents and carers also know how to support their children and young people with giving them the right information about how to become resilient and develop those resilient skills.
We want to make sure that we have staff trained throughout the health and wellbeing system within Cumbria with the right skills. And that might be teachers, it might be doctors, nurses, and other mental health professionals, but it might also be people like scout leaders, guide leaders, football club coaches. So all of those people need to have the right skills and feel that they are supported when somebody might talk to them about their emotional or mental health. And we're also developing new roles, because there are some times when we struggle at the moment to fill all the positions. So we might have the funding available to provide a service but not be able to recruit the staff that we need for the service. So we need to think differently about how we provide that service. That might be developing a different kind of role, or it might be thinking about whether we can provide a service digitally or in a different way.
We know that there are some children and young people who, for a variety of reasons, are more vulnerable, and they're more likely to need extra help around their emotional well-being or mental health. These could be children who have conditions such as autistic spectrum conditions, or it might be because they're being looked after by the local authority. Or indeed it might be because they have some additional responsibilities of their own. They might be carers, for example, for an adult living in their family. We are taking particular steps to work with services and other partners to ensure that these more vulnerable children can get ready access to the help they need at the time they need it.
If we want to get this right, if we really want to transform services for children and young people, we have to listen to what they tell us about what they need to support their emotional well-being and mental health. So we need to be listening to that individual child or young person when they tell us about their experience of receiving services, and we also need to be listening to groups of parents and of young people when they're talking to us about how they can be supported and how the support that is offered worked out for them.